Hi, in the last class, we learned about the Clostridium perfringens from the genus Clostridium. And in this class, we are going to learn about another member of this Clostridium genus, that is Clostridium tetani. And in this case scenario is there, that is a 15 years old young boy met with road traffic accident and died of severe muscle spasms after 1 week. Rather than muscle spasms, we can say that the person died of laryngospasm. His immunization schedule was inquired with their parents, which was not informative and inconclusive and incomplete. And another situation is a pregnant woman was asked by her gynecologist to receive minimum of 3 doses of tetanus vaccine before delivery. And what could be the reason? So the reason for these two important situations or one is followed by the road traffic accident, some kind of contamination with some type of bacteria results in a disease which is responsible for severe muscle spasms. Generalized muscle spasms, including the larynx, results in death of individual. And in the next scenario, next situation, to protect the baby as well as the mother at the time of delivery, for the baby after delivery to protect, the mother has to be given vaccines, and so that we can protect the mother as well as baby against a particular dreadful disease, that is tetanus. So the causative agent for this tetanus is Clostridium tetani, and now I am going to talk about this Clostridium tetani. So the Clostridium tetani, the distinguishing feature is these bacteria are possessing terminal spore, and these bacteria are spore forming bacterium, and with this presence of this terminal spore, they look like a drumstick like appearance, and these are all motile organisms, and they are sensitive for autoclaving, which is a moist heat method of sterilization. If you expose this bacteria at 121 degrees centigrade at about 15 lbs pressure for about 15 minutes, these bacteria along with spores would be destroyed. If the article is an autoclavable article, we can do that. If it is heat sensitive, then we have to sterilize those articles by using certain chemical agents like 1% iodine solution or hydrogen peroxide solution. These solutions are especially 6%, 6 to 10% hydrogen peroxide are effective in killing this spore bearing bacteria which resembles like drumstick. And these bacteria are present in soil, and from the soil through the contaminated wounds they enter into the body. So the mode of transmission is they enters into the body through the punctured wounds due to the contamination from the soil or road dust followed by the road traffic accidents, and followed by trauma. Also improperly handled or managed trauma wounds also may suffer with this particular infections. Yeah, this is a pathogenesis. The pathogenesis, it produces two types of toxins. One is tetanolysin, which is a leukotoxic. That means it destroys the WBCs, and which is oxygen and heat labile toxin. The next toxin is tetanospasmin, which is important and potent neurotoxin. This is a protein in nature with a single polypeptide chain, but it will have the two important fragments designated as A and B. And the production of this toxin is plasmid mediated, that is, which is an extra chromosomal genetic element present in this bacteria is responsible for production of this toxin. And this toxin can be toxoided. Toxoided means once you treat the toxin with certain chemical agents, these chemical agents will destroy the pathogenic nature of the toxin, but retains the immunogenic property of that particular toxin. So after treatment with a chemical agent, these toxins will be considered as toxoids, which are having only immunogenic property. And neutralization is possible by antitoxin. And the birds and reptiles are highly resistant, whereas human beings are very sensitive to this toxin. And the most toxic substance, important and toxic substance among the toxins available in the earth, the minimum lethal dose for this toxin is 130 nanograms. So by giving 130 nanograms, we can kill an individual with this particular toxin. And if you see the mechanism of this particular toxin, this toxin will be carried intra-axonally after entry into the body. After entry of the spores into the body, these spores will get germinated in the anaerobic environment, and this multiplying bacteria produces a toxin, and this toxin will be carried to the central nervous system through the intra-axonal route. And once it reaches the central nervous system, it binds to the ganglioside receptors. And as I mentioned already, this A and B chains are present in structure. The A chain of this toxin blocks the release of inhibitory neurotransmitters like glycine and gamma aminobutyric acid, that's the GABA, at spinal synapses. You know that the excitatory transmitter is acetylcholine, and inhibitory neurotransmitter is glycine and gamma aminobutyric acid, otherwise called GABA, at spinal synapses. So this A chain of this particular toxin inhibits or blocks the release of glycine or GABA at spinal synapses, and which leads to failing in to inhibit the excitatory neurons. So once the muscle started to contract, that will never be inhibited by releasing the inhibitory neurotransmitters. This finally leads to exaggerated or continuous contraction of muscles, which may result in exaggerated reflexes and muscle rigidity, and also the continuous painful spasms. These are the pathognomic features of the disease tetanus, that is exaggerated reflexes, muscle rigidity or severe muscle spasms, and continuous painful muscle spasms, which we can see in the case scenario which have been given in the first slide itself. So if you see the mechanism of action in the schematic representation, the depiction here is at the neuromuscular junction on left, first photograph will show the neuromuscular junction will have the presynaptic neuron and the postsynaptic neuron. This toxin acts on the postsynaptic neuron. This is the basic difference between strychnine poisoning or datura poisoning with this particular toxin. This tetanus toxin acts on postsynaptic neuron, whereas strychnine or datura poisoning acts on the presynaptic neuron. So these are the two differences which you have to learn. Anyhow, this particular toxin, before going for the toxin action, let me explain about how the muscle gets excited. See, followed by the electrical signal to the synaptic neuron, the excitatory transmitter, that is acetylcholine, will be secreted, and it's responsible for muscle contraction. Once the muscle starts contracting, the inhibitory neurotransmitters that you can see in the lower photograph, schematic diagram, the inhibitory neurotransmitters would be released at the neuromuscular junction, and cause for the cessation of the contraction once its function gets over. But what will happen in this particular toxicity or tetanus disease is the tetanospasmin, which is released by the bacterium. This toxin will inhibit the release of this inhibitory transmitters at the neuromuscular junction, because the tetanospasmin will bind to the receptors or competes for the receptors for the inhibitory transmitters, and thereby the muscle will be continuously in contraction because the inhibitory neurotransmitters are not being released at the neuromuscular junction. This is the reason why the continuous muscle contraction will occur in this particular case. This is the one where you can see the tetanospasmin where it acts, and the black blocks will show the tetanospasmin, whereas triangle diagrams will show the inhibitory neurotransmitters. So the tetanospasmin will compete for the inhibitory neurotransmitters, results in the continuous contraction of muscles due to the action of acetylcholine released, followed by the electrical stimulus at the neuromuscular junction. And then, what are the facilitating conditions of this infection? So, followed by the poorly managed surgical wound, this tetanus is possible. That's why operation theaters always will be taken care of the presence of these microorganisms. If they are present in the operation theater, the operations would be the surgical processes would be abandoned in that particular ward till they removed from that particular environment. So if at all anybody is suffering with the tetanus followed by the surgery or followed by the wound infection of the surgical site, then it's known as post-operative tetanus. If this tetanus bacilli is responsible for the tetanus followed by the septic abortion, abortions which would be done under the aseptic conditions, responsible for uterine infection with this bacilli or with the spores, results in uterine tetanus. This uterine tetanus is associated with lot of mortality. And another procedure is a tooth extraction. Followed by the tooth extraction, if you use the improperly sterilized instruments in the during the procedures in the dental clinic, the spores will enter into the body through these dental instruments, and they can cause for the infection. And ear boring and circumcision, this is another two important procedures. If you perform without proper sterilization controls or sterilization procedures, then these contaminated instruments may be responsible for tetanus. And another thing is otitis media. In case of otitis media, that area may get contaminated with the spores from the environmental soil, and then it may cause for the tetanus, which is known as otogenic tetanus. And another thing is very bad practice nowadays. Of course, we can't say this practice except in the very remote villages. That is application of cow dung to the umbilical stump. That's followed by the delivery. The umbilical stump would be cut from the to separate the baby from the mother, and to avoid the bleeding, that cutting end of the umbilical stump would be added with cow dung to suppress the bleeding from the umbilical stump. This was a very old, very old practice, and because of this particular procedure, the cow dung, which may consist of this bacteria, may enter into the umbilical into the baby through the umbilical stump and may cause the tetanus. Since it produces the tetanus in the neonate, that's why it's known as neonatal tetanus. This is a road traffic accident where there's always possibility is there. Any wounds may cause for this entry of this particular organisms. So clinical presentation of tetanus, the incubation period is around 3 days to 3 weeks. That's usually we say like that. Incubation period is around 3 days to 3 weeks. That means 3 to 21 days. This always depends on the nature of wound and immune system of an individual. So if the wound is very nearer to the brain, then the incubation period would be very less. And the immune status of the individual means if the individual already received the full course of vaccine, tetanus toxoid vaccine or DPT vaccine, there won't be any possibility for the tetanus. Otherwise, either incomplete vaccination or no vaccination or failure of vaccination schedules all may result in the occurrence of the tetanus disease. So in early stage of the tetanus, the clinical manifestations would be difficulty in chewing and difficulty in swallowing and also difficulty in occlusion of teeth. And the earliest manifestation would be locking jaw, that's called trismus. People are unable to open their mouth, that is called trismus. And edentulous patients always complain of inability to insert dentures. This is very important when the people are having on this kind of situation. And another thing is in advanced stage of the disease, people may be suffering with dysphagia, that means difficulty in swallowing, and the stiffness and pain in the neck and shoulders and abdominal muscles. And this is a kind of spastic paralysis, that's continuous very stiff contractions or severe contractions of muscles. And this contraction of muscles also results in paralyzed condition, which is known as spastic paralysis. But remember, hands and feet would be spared in this situation. And we can see the autonomic dysfunction also, which would be manifested in the form of high blood pressure, tachycardia, that's increased heart rate, intestinal stasis, and sweating, renal failure. All these things we can see in advanced stage of tetanus. Another complications of the tetanus are, one is rhizus sardonicus, means the sustained spasms of the facial muscles. You can see the photographs. Sustained contraction of the facial muscles results in a kind of grimace. Grimace. Here, if you see the you can see like in a person who is laughing like, but it's not. It's nothing. It's not because of the person's act. It's just because of the sustained contraction of the facial muscles. So gives like an feeling, I mean appearance like grimace. That is called rhizus sardonicus. And another thing is opisthetonus, otherwise called bowing of back. So because of continuous contraction of paraspinal muscles results in bowing of back. There's complete contraction of those muscles make the person like bow, that you can see again on the below photograph, which is known as opisthetonus. And lab diagnosis of tetanus, the specimens to be collected are tissue bits and swabs. Of course, swabs are not having much reliability, but the tissue bits are necrotic material from the depth of the wound is the best sample. And do the microscopy by gram staining. You can demonstrate the morphology of this bacterium, but remember, microscopy is unreliable. The reason is some other species of Clostridium, like Clostridium tetanomorphum and Clostridium sphenoides, which are present in the soil as saprophytes, also will have the same morphology like Clostridium tetani. So if you do the microscopy, the bacteria which resembles the Clostridium tetani are present, but it's very difficult to differentiate whether they are real Clostridium tetani or the Clostridium tetanomorphum or sphenoids. And next one is culture. We can use the blood agar with selective agent. And on cultural characteristics, they can grow on even on ordinary medium also. But on blood agar, you can see the incomplete hemolysis in early stage of the incubation, and late stage of the incubation you can see complete hemolysis. Above photograph you can see around the colonies you can see the complete zone of hemolysis. Another important property which you can appreciate on blood agar is swarming growth. The swarming is always indicative of motility of the organisms. So if you are able to see the swarming growth, that is like in a spreading growth from the primary site of inoculation, that's called swarming. And this swarming growth is important property of this bacterium on blood agar. And on RCM broth, you can see the turbidity with the foul smelling and meat particles turned black. And below photograph, if you see, the left one is uninoculated medium, and the right one is the inoculated and positive growth will be shown. So if the specimen is positive for the Clostridium tetani, you can see the turbidity in the medium, and meat particles also turn into black in color. I hope you can appreciate that change in the second test tube, which is marked like 634. So left one is uninoculated tube, right one is inoculated tube. So inoculated tube will show the turbidity with black colored meat particles and foul smelling. And the toxicity test for the tetanospasmin, because all the Clostridium tetani species can't produce the toxin tetanospasmin. Only the strains which can produce the tetanospasmin will be considered as pathogenic strains. So to know that whether the produced grown Clostridium tetani, whether it is toxigenic strain or non-toxigenic strain, we have to do a simple test. In this, we have to take the experimental animal as mice, and two mouse has to be taken. The test animal has to be given with 0.2 ml of pure culture from RCM broth into the root of tail, and control animal has to be injected with 1000 international units of antitoxin 1 hour before giving this pure culture from RCM broth. Then once you give the antitoxin to the animal, after 1 hour, give the 0.2 ml of culture into the root of tail. And if you observe after 12 to 24 hours, you can observe the stiffness in the tail, which proceeds to in the form of generalized tetanus in the test animal, which you can't see in the control animal. That means the control animal has been protected with the specific antitoxin. So you can't see any stiffness like things on the tail end. So this is suggestive of the strain which has been isolated from the culture medium is a pathogenic strain. And the treatment for the tetanus is first and foremost thing is don't close the wound. Whatever the wound which is contaminated with the roadside soil, don't close the wound. What you have to do is just clean the wound thoroughly with normal saline and also the appropriate disinfectant solution. Then keep it open. Keep it open. Don't close the wound. If you close the wound, it can maintain the anaerobic environment. What are all the spores which are present in that particular infected wound? Under the anaerobic environment, they can grow and they multiply and produces the toxin. That's why don't close the wound. Just do the wound debridement, clean it thoroughly, and then make it open like that. And after that, you have to consider the different modalities of treatment. One is passive immunization, because we don't know actually what is the status of the immune status of the individual. That's why prefer human tetanus immunoglobulin 250 international units, and if it is not available, since it's costly and it may not be available in all the places, in such case go for anti-tetanus serum of equine origin. That means which is prepared from the horses, mules, and donkeys. So that anti-tetanus serum has to be given in 1500 international units dose. But human tetanus immunoglobulins are produced from the human volunteers, whereas anti-tetanus serum is prepared from the horses or mules and donkeys. So that anti-tetanus serum, otherwise called ATS injection, has to be given 1500 international units dose, whereas human tetanus immunoglobulins has to be given in 250 international units. And antibiotics to be given are metronidazole, which is most important antibiotic which can kill the anaerobic bacterium, and penicillin also can be given. So penicillin and metronidazole both are having synergistic action to work on this particular bacterium. And next one is combined immunization. For the non-immunized persons, we have to give the passive immunization, and simultaneously we have to give the DPT vaccine also. A suitable vaccine has to be given. And next one is we have to give the spasmolytics to relieve from the muscle spasms. A suitable spasmolytic you can give, that may be a lorazepam. Usually nowadays people are using lorazepam as spasmolytic. It's a central muscle relaxant. And supportive management, admit the patient in a quiet room where the person should not get exposed to any kind of sounds or lights or heavy lights and all. And then to correct the cardiac abnormalities, give the H2 receptor blockers like labetalol. Labetalol can be given to correct the cardiac abnormalities. This is how we have to treat the case of tetanus. And immunization, the active immunization, the vaccines are available for the active immunization. We have the formalin inactivated toxin, which are available in the form of monovalent vaccines like plain toxoid or toxoid with alum. That's alum aluminum hydroxide. And multivalent vaccines also available, the most popularly known as DPT vaccine. But nowadays, in spite of DPT, we are using DTAP. So in DTAP, along with the diphtheria toxoid and tetanus toxoid, that is incorporated with acellular pertussis toxin, which is more safer when compared to the killed pertussis toxin. So in spite of DPT, better to give DTAP. And the 3 doses have to be given starting from 6 weeks of age, and then at 4 and 6 weeks interval we have to give another 2 doses. So the first dose has to be given 6 weeks. After that 10 to 12 weeks another one, and the next one is 14 to 16 weeks or 18 weeks we have to give one more dose of vaccine. Like this 3 doses have to be given, and booster dose has to be given at 18 months of age, and one more dose at 5 to 6 years, and one more dose at 10 years of age. If the person is a frequent traveler, again it's better to give the tetanus toxoid now and then, so that we can protect the individual from this tetanus disease. So with this, the take home message with single photograph is, most of the times people who met with road traffic accidents may suffer with this tetanus disease. The main reason is, followed by the road traffic accidents, the severe wounding may get contaminated with the road dust, which consists of many number of bacteria or spores, and which enter into the body, and once they germinate they produce toxin. That toxin is responsible for disease tetanus. So the in single word I would like to take the take home message is, be careful about the road traffic accidents. That doesn't mean that in other areas it's not possible, but this is very important to remember when compared to the other incidents. So this is about the Clostridium tetani, and the disease produced by Clostridium tetani is tetanus, which is a preventable disease, and it's a dreadful disease, and it may cause for the severe mortality also. But it's having vaccine, so don't ignore the vaccine for this particular disease. Thank you.